when we have a system that locks down everyone,
Yeah.
the healthy, people who are vulnerable, we have a huge economy that is crashing and putting people at a lot of risk for a lot of other things. A lot of people are dealing with mental issues. People are losing their small businesses that they've worked so hard for.
Yeah.
And we're creating a huge problem by this. And I think it's important that people get to decide what they believe is safe or not, and that the people who could be harmed by this really do stay home, and that we can help them stay safe. We can make a system that makes sure they have food, but have the rest of us catch COVID and create a sort of herd immunity.
This thing with COVID-19 is about destroying your immune system. Or if you have a compromised immune system, then you can get COVID-19 a lot easier. Any flu you can, right? It's a flu. They shut down the whole economy over a flu. It's terrible. Yeah, let's be careful, but we need to get back to work. We got to look at the whole picture, right? I mean, I want people to be safe and hand sanitizer. If they want to wear gloves or mask, whatever, go ahead, do that. But it should be anyone's right not to do that too.
I think there's a bottom line without having to get into anything too deeply, and that is that people are being censored a lot. Like he's talking about David Icke, there's so many people, I have so many friends, they are being kicked off Facebook.
Any conservative voices are taken off. All my posts get taken down all the time.
If you question something, it is being taken down. Even on YouTube there's people, all their videos are getting demonetized, even really big channels like the Rufin Report, anything that is questioning ideas, and we always have to question ideas, otherwise we're going in a totalitarianism way, like in a really dangerous direction. And even the vaccination with 5G towers, whether they're good or not, there needs to be discussions. There needs to be questions, and these discussions aren't happening. Like we have so many doctors and scientists that want to talk, for example, with the scientists at the CDC and have open discussions about this, and they will never go for it. They always said we're not allowed. Or with 5G, we don't have long-term studies. So when you're rolling out something that's going to affect everyone, we need to have long-term studies, but it's just kind of getting rolled out, and then it's more like, okay, we'll see where this goes. If it hurts a lot of people, then we'll go take it down again, and if it doesn't, like we're kind of all guinea pigs in a way. And I think the biggest problem is that people feel like there is no more corruption.
Yeah.
So then they feel like they're safe. And then there's people looking out for them, but there's always corruption where there's power without wanting to be cheesy or anything.
You guys getting a lot of honks today?
They're good honks.
We've had a bunch of people swearing at us and stuff, and that's terrible. Like, they're like, oh, yeah, effing this and effing. There's ladies here, and there was a couple of guys swearing. I'm like, you better quit swearing, like, pissing me off.
It's all about choice.
Yeah.
I think that's what's so important. If you want to live in communism or in socialism, where somebody's out there telling you what's safe or not, what you're allowed to know or not, then that can be your choice. But it's so important that is never forced on other people.
So what do you think about all these protesters? What's your thoughts on that?
On the protesters?
Yeah, it's funny. I spoke with you earlier, and you said you hadn't heard of any protests. Is that right?
Yeah, and then I kind of went online because I've just been like hiding out in my apartment, and
Right.
I haven't really been checking much news in the last few days because of a death of a friend. So I
Right.
haven't
Sorry to
really
hear that.
missed the protests are happening, but yeah, they're protesting the lockdown, I guess.
Yeah.
And enough is enough, and they want out, and that's fair. I mean, at the end of the day, I don't know. Maybe we have done what the healthcare wanted, flatten this curve. I don't know. I'm still sort of torn between like whether I think it's a good idea to reopen or not.
Mm.
I
A lot
don't
of
know.
a
That
lot
could
of
be
a lot of a lot of folks just say that they call it they're like, oh, it's just a flu, and
that it's not. And I think
right.
that's the part of me that's like, yeah, we shouldn't be reopening. And I think because of the lockdown, there might have been a lot of people who did not get infected, and they're just kind of tired of sitting at home alone or at home, period. So now there's talks of like, oh, this is infringing on our civil liberties. But like at the end of the day, this is not just a flu, but doctors are saying that too. Like my own GP I talked to today,
Yeah.
and I have a homeopathic doctor as well who I talked to who had said that initially to me, that it's just like a flu, so don't worry.
Huh.
It certainly did not behave like a flu.
Right.
So I have no idea. And that was early on that they were saying that, so maybe they didn't quite understand. But my GP is now the same GP who's like, yeah, it caused you to have some damage in your body. So the last time we had talked,
Yeah.
a lot more happened after that to actually worsen it before it started getting better. And so the people who want to come out of lockdown, I don't know, like, I think it's really risky. It's probably going to create a resurgence of the virus. And I have my own sort of questions, like, why do they want to end it so early? Is it because of money? They want to make sure the economy doesn't tank that bad, but it already has, right? Or is it
Yeah.
because they do want people to get more infection so we can have a herd immunity? And I've noticed that concept of herd immunity is just like dropped out of the news. Like no one's thinking about that anymore, and I just don't believe
Right.
it, right? So that makes me a little suspicious. And then conspiracy theories are making me suspicious. Again, I don't know. Conspiracy fact is also a thing.
Yeah.
We don't know enough about what this thing is still, and that blows my mind because it's been months. We should know a lot more than we do. But because we don't, I'm a little afraid. I'm going to stay in, I'm going to keep doing what I've been doing and not take any more chances because for me it was hell.
And I think what blew me away was that you had gone to a hospital that seemingly was empty. Like the hospitals were kind of empty, waiting for this thing. And I thought to myself,
The thing that never really happened.
right,
And now they're
eh,
praising themselves because it was all because of our social distancing.
right.
Oh, there's so much wrong with that. There's so much wrong with that. Like, where do you even start?
Yeah, well, you didn't get any information on the enemy, right? And the enemy, if the enemy is this virus, you didn't get a chance to really examine the enemy. And
Yeah.
I mean, obviously, we don't want I don't want to see any nurse or doctor, get infected and get sick. I know that they have families. I
No, I get that
you
too.
know what I mean, right? Like so you,
But like,
but
where's the
yeah,
line, right? Where's the line?
yeah,
Like,
yeah,
the first time the paramedics were at my house, I think I mentioned to you that the first paramedic that came near me was so scared. She
yeah,
dropped the thermometer like 3 times just trying to take my temperature, and
yeah,
the other guy wouldn't even come in.
yeah,
And both times I was at VGH, it was empty, and all 3 times I was examined by doctors, they didn't touch me other than to listen to my lungs, and I'm like, wow, this is like a very complex disease or
hmm,
infection, and you're just listening to my lungs and making decisions based on that. Like that's just.
yeah,
And they tried a lot of times to pin it on other things so they wouldn't have to do anything more. So like
right,
night of April 4, when they said we're going to test you for a heart attack, they said, just so you know, we're not going to do anything else other than that.
yeah,
I'm just like,
yeah,
okay, like, but why? Oh, we don't want to get our machines dirty. I'm like, you really just said that to me. Wow. Like
yeah.
they're openly admitting that they're going against their oath, which they take as doctors to protect themselves.
I know a ton of people that are just live on their own and maybe don't have a lot of family to
Mm-hmm.
talk to and so forth. And yeah, I did hear you sent me some information on some folks that had passed away and been found. They were found on their own.
Mm-hmm.
And that is frightening. So
And you know, there's
If there is a second wave.
yeah, it's gonna be the same. And the thing that I am really grateful for, that I'm aware not everyone has, is I have a very vast network of friends. And
Right. Yeah.
I was ill. I don't know if my friends know this, but I made a list of everyone that helped me. There's about 30 people on that list that I still have,
Oh,
and I will.
that's awesome.
Like each
Yeah.
one of those people is going to get something from me as a thank you. Like
Yeah.
30 people, you know, it really showed me how many people care.
Even if this year's vaccine isn't very effective, health officials continue to tout its benefits. But some researchers have noticed a curious and haphazard correlation between one season's vaccine and the next season's flu. Kelly Crow explains.
When it comes to the flu shot, nothing is simple. This year, the vaccine was so mismatched. In healthy adults, it offers almost no protection.
Maybe not zero, but it's certainly far from the kind of protection that we typically expect.
In a normal year, that's about 60%. But there's always a risk that the vaccine won't be a good match for the virus. And there's another inconvenient truth emerging. Research is showing that getting the shot one year might make the next year's vaccine less effective.
That's an uncomfortable thing for people to hear, but it definitely seems to be a real effect.
For more than a decade, scientific papers have reported unexpected findings of lower effectiveness with repeated vaccination, a strange negative effect of prior year vaccination on current year. But flu experts can't quite explain this curious effect of repeated vaccination.
Yeah. Well, there's still, as far as I know, there's still no proof anywhere in the world of human-to-human transmission of corona.
Really? Are you for real?
Well, the reason why I say that is, okay, yes, the corona is a nasty virus, but the theory that I'm going with, because I've studied infectious diseases for 2 years, is it's actually being transmitted through vaccine.
Okay, yeah. Now that's...
It's not a human-to-human transmission. People are getting it because the vaccines they've made since 2015 have a deadly combination of viruses in them, particularly the flu vaccine. And corona is in it.
I see.
So people are getting it, and they're dying maybe, but it has nothing to do with human-to-human respiratory transmission. And so how would you ever prove that? Somebody gets sick and dies, they test them and has corona. You can't go, oh, well, I saw it leave Peter's mouth, and he breathed on Jane, and that's what killed Jane. Like, respiratory diseases are invisible.
Right, yeah, no, exactly. And I mean, I still have yet to get a response back from Fraser Health in regards to contact tracing.
Oh my God. There's just so much money in all of this stuff that circulates around this industry, from the masks to jobs to linen for the bed, for pretend hospitals that are set up. Like I don't know if you know this, 40% of the entire British Columbia budget every year, so whatever the government spends, like the British Columbia GDP is $450 billion a year. That's how much money we make in BC. All the businesses, everything is about $500 billion.
Okay.
And so what they spend is, let's say it's $500 billion too. I don't know. Okay. Right. So Adrian Dix, who's the Minister of Health, he gets 40% of that money. One ministry, the health ministry, gets 40% of the entire budget. And we have 12 ministries. So there has been a trend in the past 20 or 30 years, mostly coming from the States, big American corporations into Canada, what we call corporate managed medicine. So this is not like me being healthy, eating vegetables and exercising and taking care of my family. That's health, that's natural health. Corporate managed medicine is a major global industry. And that's why Adrian Dix gets 40%, because our tax money is going into that industry to build bigger hospitals, more machines. I mean, you just have to watch TV and you see all the ads for these hospitals. It's like they're advertising sickness now. It's profiting off the decline of health.
Yeah.
And we see this pattern globally, everywhere. Health is declining.
Yeah.
And it's because there's profit, there's more money in a sick population. There's no money in someone like me and my family, a bunch of vegetables, some Band-Aids, and Tylenol once in a while if I drink too much vodka. There's no profit off a family like mine. And these corporations have shareholders and they want dividends. They're not trying to really get people to be healthy. They're trying to make a profit in the medical industry. And that's what I'm trying to do, is get people to see it as a business, see the bigger things that are going on around us and what's motivating them. They're motivating policy, they're paying off politicians. But the best thing that happened was we were all standing there watching all these nurses, and we respect the doctors and the nurses. I mean, of course, everybody does. Who doesn't respect the doctors and the nurses?
Right.
But we're all standing there in their biosafety gear in the public, exposed to germs.
Yeah.
And that's a breach of protocol. They're not allowed to do that. And so we're all sitting there going, why are they all outside? And we've seen them in videos doing this before, and that's why everyone got angry, because we were like, this is fraud.
Right.
Those nurses are going to go back up there and they're going to break safety, because there really is no pandemic. And the reason why I'm really passionate is this is what killed my mother. She was really deceived all through the 60s, the 70s, and the 80s that smoking wasn't harmful. Well, the doctors were on the ads, right?
Yeah.
They had doctors in the ads, and so she was the victim of that. She was a result of that, and she could have stopped smoking, right? She had a choice, but she was way too addicted. And she died in the 80s, and it was 17 years later that they put the warnings on the packages of the cigarette. 17 years after she died. And I always think, I wonder how many more mothers died in those 17 years.
Yeah.
And when I started researching vaccines, and I saw that chemicals, agrochemicals from commodity feed that was given to animals, and those animals, their blood is drawn to manufacture a measles vaccine, I was like, those agrochemicals will go into the blood, and that blood's going to go into a kid, and it's going to go into that kid's brain, and it's going to damage that brain. And I sat back and I was like, this is exactly what killed my mother. It was an industry that had no regulation and nobody knew much about it. I couldn't believe the average mother wouldn't know there could be chemicals, agrochemicals in her child's vaccines. And a light bulb went off and I was like, this is the work that I want to do. And this is happening all over the world. These companies don't want regulation. They fight with lobby groups and hundreds of millions of dollars to stop regulation.
I'm not able to speak to specific actions that have been taken around COVID-19 in BC, but just in terms of general public health pieces around contact tracing and testing and viral spread and containment, I can talk about that for sure.
Okay, so shoot, what's contact tracing? Because it's been talked about so much.
Yeah.
What does that really entail?
So, Desiree, it's a great question, and contact tracing is one of the essential components that is going to get us out of the current curtailments and closures, and especially as provinces reopen. I mean, one thing I do know, at least from the popular media, is that BC is reopening. Here in Ontario, we're also moving to phase 1 with certain things reopening as well as of tomorrow. And so really what contact tracing is essentially there's 3 things that you're doing. First thing you're trying to do is you're trying to figure out where the person may have contracted the disease. So this is done not just for COVID-19, but we do this for all manners of infectious diseases. So things like chlamydia, tuberculosis, you name it. Like we'll do contact tracing for that stuff as well. So this is bread and butter public health. But in any case, what happens is when someone's diagnosed with the disease, let's say in this case COVID-19, there are three things we want to do. First of all, the individual that's diagnosed needs to be given some advice and some direction as to what they need to do. So whether it's go home and self-isolate for 14 days and we'll check in on you regularly, that's one part of it called case management. The other thing is an exposure assessment, which is basically where you're trying to figure out where the person may have got the disease from. So you kind of try to work backwards and see, had they traveled somewhere, had they had close contact with someone who might have had COVID. And so that's called an exposure assessment. You're trying to figure out where they got it from. And then the third most important part of contact tracing is the actual tracing itself, where you're basically trying to figure out, when was this person infectious and who did they come in contact with during that time? And so this is where you need to figure out who they've had close contact with, because we know this disease is spread through close contact droplets, usually over like 5 to 10 minutes with someone else. Right. And we do know that it also spreads pre-symptomatically sometimes. So sometimes just before someone develops symptoms, they may feel completely well, but they're also still spreading the disease. Right. So what we do is we calculate a couple days before the person's symptoms started to when they were diagnosed, and then basically when the measures came into place, and then we try to figure out where they may have been, who they may have come in close contact with, obviously their household, maybe people at work, maybe people here and there, and that actually allows us to then reach out to those people and say, you've been exposed to COVID-19, you should actually be looking for symptoms and probably staying home to make sure that that you don't spread it around in case you might be infected. And also that they should get tested. So it really is like kind of a bit of sleuthing. And I'll be honest with you, the thing about the closures and the curtailments, that was actually really helpful for contact tracing. Because if you think about it, if you're just staying in your household bubble and if you get sick, the only people you've really had close contact with are people in your house. So that actually makes it easier to do contact tracing. Whereas in the first part, when this thing was out in the community, I still remember we had cases like people went to like the grocery store, the bank, they went to a nightclub, and then it was just like, the number of contacts you had to follow up on, it became really challenging. But that's contact tracing in a nutshell.
How are you going to go ahead doing this? Are there any tools that are going to be in place that ideally, as the health authority is going to look to try to be able to work with to figure things out?
Yeah, all health authorities use the same kind of tactics in the world. So certainly, for example, Alberta's introduced a contact tracing app, but an app is only really useful if it's taken up broadly, and if it's not taken up by a lot of people, and plus there are lots of privacy concerns, etc., with an app. So that really makes an app kind of more of an adjunct to what we do in public health. And really, the bread and butter part of public health is case and contact tracing. And so basically, we've got public health nurses. They will basically call the individual. They'll do a questionnaire, figure out all these different places they may have been. Yeah.
Is it in regards like treatment, like so? I'm thinking of contact tracing. Some of the reports that I've heard is that in some cases, and I don't know if that's the case. I can't say that I've actually heard anything about it being the case necessarily in BC or in any parts of the rest of Canada. But is there? I mean, I know some people supposedly they've had contact or they've been diagnosed with COVID, but they've died or passed away from some other reason, but they're counted as a COVID death. Mm-hmm. Is there a breakout?
If you really want to figure out if COVID caused the death, then you actually need to do a detailed autopsy, like a postmortem analysis, right?
Right.
And the challenge with that is, even if you do that, there's still no guarantee that you're going to be able to figure out what the actual, like whether it was COVID or whether it was something else. You'll do the autopsy and you'll say, on a balance of probabilities, it might have been this or it might have been COVID, but you'll never really know for certain, because again, there's different complex like biochemical and kind of like you're looking at issues in the blood, issues in the lungs, all these other pieces. So a lot of the times you basically just have to say this person died and they had COVID, and so we're going to count it as a death, a COVID death as was described. But it's basically a matter of, first of all, we'd have to autopsy everyone. Second of all, the other issue is there isn't really the broader capacity to really delve into that right now. Really, the focus has been on trying to direct our healthcare resources to containment and controlling spread.
Right.
So there's all that. And I think the better metric, if anything, is less about the actual deaths, but more just looking at deaths as a whole in terms of excess. And I'm sure you've seen this throughout the world. The idea that over the last few months, in many places in the world where COVID has sort of rampaged through, they've seen way more deaths than they would have in a comparable month over the last 10 years. So, for example, in March 2020, you're seeing like 4 times, 5 times more deaths in New York City than compared to Marches previously. Now, you could say that, sure, maybe there's some other factors that are related to that, but given that COVID is also there, many of these people are dying with pneumonia and with other pieces that you're maybe not necessarily confirming through an autopsy. I think to be fair, Desiree, I'll see your point. Maybe it is, there may be certain deaths that are overcounted, but I don't think the proportion of deaths that are overcounted would be enough to invalidate the whole number. I think it's probably capturing most of the toll of COVID. Maybe there's a few ones in there that are just kind of like, they kind of died of something else. But whether COVID was even part of the chain that led to that something else,
Right.
it's tough to know, and it's better to just at this point go with that as the metric. So
Okay. In a broader term, obviously this is not, we are dealing with the way things are as they are right now. I mean, whether the government as a whole, we decide to, continue down the path of using social distancing primarily as a model, or locking things down when needed, and so forth, going on for the next, who knows, couple years, depending on how things are going, or whether or not we decide to open it up. It doesn't really, it's kind of out of our hands. But in an ideal world, and I know that you're not speaking for the Peel region on this, but looking at it scientifically, or is there a better way for us as humans to live? I look at New York and I look at, this is a massive city crammed with people. Yeah, of course it's going to get hit if something goes off there, because you're just all together. How are we eating? The biggest hit on business, there's businesses, and I would say that probably the food industry has suffered a massive hit economically. At the same time, we know that if you're a person eating out, and I'm one of those people, you're probably not as healthy. Again, I'm one of those people that you could be if you're eating, a good balanced diet of fruits, vegetables, and proteins. Balance, probably from farm to table would be even better. Have we created these viruses? Have we created this situation?
So Desiree, it's a great question. And I think the big thing you have to remember is that we are seeing all kinds of emerging infectious diseases nowadays. And a lot of it is because, as you've described, like humanity is, as our cities expand, as our need for natural resources continues to grow, humans are starting to go into more and more places where they traditionally haven't ventured. And the other part is also, as you mentioned, with our cities being crowded, with climate change happening, and so vectors can live. There's a lot of factors here that are leading to resurgences in infectious diseases, and also brand new infectious diseases like the one we've just seen there. I think the reality is that wherever there's always going to be human beings, there will always be some sort of risk of a contagion. That said, I think there are steps that we can all take, and I think what we've done, at least in the interim, with the closures, was we were trying to weigh the immediate risk of essentially like significant death and sickness that would have overwhelmed our hospitals. Healthcare workers probably would have troubled and traumatized paramedics, first line responders, healthcare workers, long-term care workers, and many of them, especially here in Ontario, where we've had a bigger long-term care crisis than you folks had in BC.
Yeah.
Those people are going to live with that for the rest of their careers and their lives. And imagine if that was like on a New York or a Wuhan level scale, it would have been terrible. So that was the immediate threat. We have always recommended that. We've always recognized that the closures were not going to be permanent. Like these were, because we knew that the longer the closures last, you're going to have, other long-term impacts in terms of, people who are suffering, say, from domestic violence, people who have mental health issues, who are suffering from loneliness, isolation. So it's always been trying to thread this needle between these two extremes. And really what we did with the closures is we managed to get the virus under control. The thing that no one talks about when they talk about flattening the curve. When you flatten the curve, what you're essentially trying to do is you're trying to take back control from the virus. Because before we closed down, the virus was dictating the timeline, right? The virus was like, I'm going to spread. I'm going to just take advantage of all your relationships and interactions and all this other stuff, and that's how we're going to do it. By shutting it down, what we've now done is we've taken control back from the virus. We've got the fire under control, and then how we open up and live our lives in the coming months is going to allow us to let this be a controlled sort of return to some sort of normalcy with a lot of distancing and hand hygiene and all that other stuff that otherwise wouldn't have been possible. So I know a lot of people have definitely taken a hit and sacrificed a lot over the past 2 months. I think it was done for a very worthy cause, because in Canada we have had, BC, Ontario, Quebec, Alberta, like even though there's differences between them, on the whole, we in Canada have actually done probably the best out of every other G7 country in the world, save and except possibly for Germany and Japan.